back to Health Insurance Sherpa, where we offer easy-to-understand health insurance advice and pro tips. Today we're joined by my health insurance advisor and educator, Kim Anderson of Black Gould, a Warner Pacific company. Welcome, Kim.
Thank you. I'm excited to be here.
Thanks. So I'm really looking forward to joining our combined experience and sharing it with the listeners. So let's start with the big picture. So there are 7 major ACA insurance companies in Arizona. So when someone's shopping for health insurance, what would you say they should begin with?
So I really think it's, like you said, more about the bigger picture, not just looking at the monthly premium. So things that they want to take into account are doctors, they're not only their primary care, but any possible specialists that they're going to be seeing, what hospitals they might go to, what treatment or prescriptions they're going to be taking. Are they going to be traveling? So maybe there's somebody who doesn't primarily stay in Arizona, but they leave the state. How often are they going to be doing that? So just thinking about your needs overall.
Right,
and
the whole year.
Yeah, the whole year, yes.
Yes,
yeah.
Perfect. So I'm sure a lot of people are overwhelmed by the whole process and maybe not thinking about all of those pieces or the big picture. I think that is really important. So let's talk about how the plans work and start with referral requirements. Which plans need referrals? How do they navigate that?
So out of the 7 carriers, 3 of them require referrals. So that is going to be Antidote, Imperial, and United Healthcare. Referrals is really thought of more of a coordination of your care. So while it seems like an unnecessary step, the reason why some of those carriers require that is because they really want to help their clients manage their care. And one way that they look at that is with the primary care doctor being able to first take a look at them or help them determine what additional needs that they have and who else they should be seeing. Right. So that referral is the gatekeeper going to the primary care doctor first, and then them really sending the referral to the specialist. One thing with clients who are going to specialists, they need to make sure that the specialist that they're going to is in network.
Right.
Sometimes the primary care doctor isn't always familiar of, even though they're managing that care, who's in network. So just kind of a tip to make sure that when they are referring you or the clients to a specialist, make sure that they're in network with your plan.
Yeah, perfect. And they need to know exactly what their network name is. I did a whole nother podcast just on the specific networks because a lot of people say, I called my doctor and they take Blue Cross. I said, well, do they take the Focus network? Do they take the ACA Health Choice network? Absolutely. And that would be a big difference for the referral.
Absolutely.
Okay, perfect.
So understanding your plan that way, yes.
Yeah, and the only plan with Blue Cross Blue Shield is that ACA Health Choice.
Yes, but, you're right. And then that Blue Cross does have the one plan.
Yeah. So 1 out of 10.
Correct.
All right, so travel is another topic that really comes up a lot. People want to keep their national network, their PPO, and you have to kind of talk them through. It's an HMO, but we do have some companies that will work fine for some travel.
Yes. Yep. So some of our carriers have that open access feel. So while it's not a true PPO with a national network, they do allow either to step into other states and utilize their network, which is called reciprocity. So Ambetter is one of the top carriers with regards to that.
Yeah.
So it's not your PPO, but when they're traveling to a state that Ambetter offers their plans in a network, which is in 27 states, with the exception of California and New York.
Yeah, a lot of people want them.
Yes.
Especially California, being in Arizona.
They can seek in-network care that's non-emergency from providers that are in their network.
Yeah.
In all the carriers, if it's an emergency, of course, they can seek emergency care within the United States. They just go to the closest hospital as long as it's deemed an emergency.
Like
then
a true
it will
emergency,
be covered.
how the doctor bills it. I always say
As
it's up
a
to the
network.
doctor's code because they want to say, what if this happens? What if this happens?
Yeah.
But we can't say that. It's up to how it's billed.
Yes, exactly.
And what's really going on.
And sometimes even when it is an emergency, when they send it over to the carrier for whatever reason, the carrier does not process it as an emergency. So just make sure, one thing when you're looking at your explanation of benefits, which is that overview that you get from after going to receive services, that you make sure it is being covered if it truly was an emergency. And if not, reach out to either your broker to help guide
Yeah.
you through that, or
Insurance
the hospital,
company.
insurance
Yeah.
company. Just use the resources that are available to you.
Right, well, let's talk about the No Surprises Act real quick, because
Yeah.
if it is an emergency situation, they cannot bill you because you didn't have a choice. Because if
Correct.
it was a true emergency. So I think that's pretty well handled now, but once in a while, a situation comes
Mm-hmm.
up where they did get a surprise bill.
Yes, and
So check your bill, check your EOB, like you mentioned. You want to
Yes.
check that first and see what the true cost is.
sometimes we're still seeing it with like anesthesiologists
Yes.
are notorious for that.
That's exactly right.
But yes, those explanation of benefits, I think sometimes you might not remember that you're getting them, maybe because you're on electronic delivery. So just go into your members and clients can go in to their member portal within their carrier and see those and see the
Yeah.
accumulations towards their in-network out-of-pocket maximums and make sure that it is being billed appropriately. But yes,
Yeah.
there are rules and regulations now with that No Surprise Act that
That's been so
don't
helpful.
allow providers in those situations to balance bill.
Yeah, and I've heard from clients too that they will get a bill from an anesthesiologist or something, and then they're like, oh, why do I have this $2,000 bill? I said, don't pay it.
Correct.
Everybody should register for their member portal with whatever insurance company they have.
Yes.
Because you're going to get so much information there.
And that's also one thing I stress to brokers to communicate with their clients. When you're in the hospital, they make you feel like you have to make that payment
Yes.
right then and there. And
Yeah.
they have their computers in the room with you. You do not have to. You
Right.
have the right to say, no, send the bill through my insurance company first. I want to make sure that it's billed properly in the way that my insurance should cover it. And I'm going to wait until I see the explanation of benefits to make sure that I'm paying the correct amount and not having to go after a refund.
You don't want to recollect it. And what if you paid with your
Yes.
HSA? That really gets messy.
Yes.
I just had that experience, actually. My son had gone to get his wisdom teeth out, and they said, okay, it'll be $997. I said, I'm not going to pay you right now. Bill my insurance first. So I did make a partial payment, and then just this week, they called me and said, oh, guess what? It was $200 less than we had expected.
Oh,
And I used my
interesting.
HSA funds. Anyway, so
See,
that's a very important tip. Very important tip.
Just to piggyback off of Ambetter, so while they offer, for going back to our travel question, while they offer that reciprocity in 27 states, not all the carriers are like that.
Right. They're very unique.
Yes, they are very unique by carrier. Most of them do offer the reciprocity within Arizona where they offer their plans in the counties that they offer them in. Blue Cross, and it does depend on where you live. Blue Cross also have what they call a blue card. So that does give some additional travel benefits outside of the reciprocity counties that they offer. So really, that's just, I would say, a question that clients can ask is, if I travel more while these are HMO plans, do they give me other opportunities and benefits too when I'm traveling?
Right. And then another thing is that sometimes somebody might live up in Sedona or Prescott, but they come down here because there are just a lot more doctors in Maricopa County.
Yes.
So that's another
those are
reason.
those.
I think all of them pretty much offer care. Most companies offer care in Maricopa County.
Correct.
So if you are in
Correct.
another county, it's very likely that you can get care here too.
Absolutely.
So-
Yes.
Or maybe
I would agree with that.
Okay. So what about the other carriers that maybe don't have that clear reciprocity? What kind of, besides emergency care, is there anything else, urgent care?
Telehealth. So
Oh, yeah,
all
telehealth
of
is
the carriers now include telehealth on their plans. And that is great. Just even speaking from personal experience with my kids, I've used that time and time again, or for myself. So things like sore throats, UTI, ear infections, sinus infections, your common illnesses that you can have a conversation with its licensed medical providers. So whether that be nurse practitioners or an actual doctor, 24/7, pick up the phone or go on the app to connect, and you can call and speak with that licensed professional.
Yeah.
And if it's something based off of the symptoms that you're giving, that they could just call in a prescription to your chosen pharmacy, they'll do that. And you don't have to even step foot into the primary
Right.
care doctor, urgent care.
Time saver, money saver, it's free
Totally.
on most plans.
Most plans is free. Now, if you're on an HSA, deemed eligible plan, oftentimes it's
No
not.
copays,
Yes,
yeah.
it would be the contracted rate. But for a lot of the plans, it is a $0 cost. So also something that when you're traveling, you can have access to, that
Oh, yeah.
you start to get those symptoms.
Yeah, I
It's a
think
time
that's-
saver.
Yeah, I think it's a time saver, and it's just a little bit of peace of mind. So what
Yes.
happens, like my child gets injured or something while you're traveling.
Or in
There
the
is that
middle, yeah,
option.
traveling or in the middle of the night. I've used it with my
Yes.
kids, waking up
That's
with
when it
ear
always
infections.
happens, 10 o'clock at night,
Yep.
2 in the morning.
Yep. And then
think
just make sure you know your local pharmacy that is open 24/7, and
Yeah.
that's your game changer.
Well, let's talk about the pharmacy real quick too. That's something when I had the flu a couple years ago, I called telemedicine. I had a provider on the phone within 10 minutes, talked to them, they prescribed Tamiflu or something like that, and within 15 minutes it was at the pharmacy.
Yes.
But I went on GoodRx and I found that it was like $40 cheaper maybe at Safeway versus Fry's, or
Yes.
there was some difference between the pharmacies. So even when you're using telehealth, maybe use GoodRx or your app to find out where the lowest price is, because it can vary.
Yes, and that's something I would say do while you're on the phone. Even the prescriptions, sometimes it'll give an alternate option that, maybe that provider is used to prescribing just a certain medication,
Right.
but it's more expensive than something else that's available.
Okay,
So
like an antibiotic or something like
yeah,
that.
yep. So that's certainly things that will help save money over time.
Right. Yeah. Always advocate for yourself.
Yes. Ask the questions.
Yeah.
Is there something else that would work that's less expensive?
Yes. Something generic. Make sure they're prescribing or allowing a generic.
Yes.
A lot of companies want you using them instead of the brands.
Yes.
They will really incent you to do that.
Absolutely, absolutely. You might be looking at a $3 cost versus a $100 cost.
Yes, for sure. Okay. So provider networks really are one of the biggest deciding factors. A lot of times that's really where I start. That's part of the discussion in the first phone call with a client.
Yes.
So let's talk about, which doctor they see most. What advice do you have regarding provider networks?
Yeah, I really think that is truly one of the most important factors when you're looking at the plans. It's not going to help you if you're saving premium, if you can't go to your preferred primary care doctor, if you can't go to your specialist. So when your clients are working with you, they need to come with that information, not only the facility name, but the actual provider name that they're seeing there. Because a lot of times the providers are contracted under their individual name versus the facility name. So, who's the primary care doctor? What specialist do you see regularly? Do you have a surgery coming up?
Right. You better have that hospital in network.
Yep, the hospital, because while a hospital, you can go to any hospital for an emergency, if it's planned care, it does have to be in network. So not only does the facility, but the providers and the people that are going to be caring for you when you receive that surgery.
Yeah.
So those are things to take into account when thinking about what your needs are going to be, and thinking about the plans. The goal is to get a plan that's going to best fit your needs, and that's
Right.
part of the
For
consideration.
whole year, all
Yep.
expenses.
Yes.
Exactly.
Yep.
So more on those provider networks. I did just do a podcast on July 14th that really goes into all the details with the provider networks.
Okay.
Knowing what their names are, how to ask, like you want to ask if the doctor is contracted with that network, not
Yes.
just do you take this network,
Yes.
because that's come up so much with Blue Cross United. It's such a big company with dozens of networks.
Yeah,
So
and
we have
that's
to be
where
real
you
specific.
said getting into knowing some of the plan network names. So some of our big provider networks around here, so Honor Health. Most of the carriers accept Honor Health, with the exception of United HealthCare and Antidote. Those are some carriers that don't have Honor Health in there.
Actually, I think it's Imperial.
Is it Imperial? Yes, I'm sorry. Imperial, not Antidote. Sorry. So United Healthcare and Imperial do not have Honor Health. Phoenix Children's is another big one that we get the
Yes.
question on, and Imperial right now is the only carrier, and it's under their multi-plan network. So they have, like I'm sure you discussed, two networks within their plans.
Right.
Oftentimes, unfortunately, providers don't recognize that they have both of those networks, and so it's important that when you're using your plan, if they initially say, or if they're calling Phoenix Children's and they say, nope, we don't take Imperial, they're starting to become more educated.
Okay.
But initially it was a big problem with them not knowing that, yeah, actually they do, but it's under the multi-plan network versus their normal Imperial network.
I think in the beginning, we were advised to call Imperial and let them know they're going to be using the multi-plan or going to Phoenix Children's. Is that still something recommended?
Still recommended,
Okay.
yes, especially because Imperial is one of those carriers that does require that referral. So not only is it recommended that they call Imperial customer service to help facilitate the care, but they do still have to get that referral from their primary care doctor to go to Phoenix Children's. The other one that I'll point out is Dignity. That's your St. Joe's downtown. They're part of the Dignity.
Yes.
And your Barrows is also part of that network. So the only carrier right now that accepts or has Dignity as a part of the network is Cigna.
And we're losing them.
And
at the
we
end of the year.
are losing Cigna, unfortunately. And they're exiting not only in Arizona, but on all states.
Okay.
So we're not the Lone Ranger on that.
Yeah. Similar to Banner Aetna, what they left this year.
Yes. So Cigna is not the most competitive carrier, where we really do see that membership is typically for people either who have diabetes or that need that Dignity access. So that's something come this open enrollment. If you have people who are on Cigna or you're on Cigna, you really are going to need to consider your options and how possibly you can access the care that you need. So
Right, and maybe start the research ahead of time. Usually,
Yes.
like what I did for Banner Aetna last year is I reached out to my clients early.
Yes.
And I started gathering their doctors and doing some research, so we're ready to go. But that
Yes.
was a lot more clients than are with Cigna right now.
Yes.
Because they haven't quite been as competitive as some of the other companies.
And that might also be a conversation they can start having with their doctors of, are there options for continuation of care?
True.
If they're currently under treatment, there may be options for continuation of care. Now, if it's just something that they're going for follow-ups or they haven't been under actual treatment of care, it's just a ongoing checkup, that's not something that typically is considered for continuation of care. But
Right.
if they're in the middle of treatment, they may have
Right,
that
something
option.
maybe more serious.
Yes.
Okay.
Yeah.
Okay,
Yeah.
good to know. And then Blue Cross Blue Shield has a brand new Persano Center,
They
which
do.
I actually toured with your company
Yes.
a while ago. I'm going to go back again next month, but that's a really nice facility.
It's
And what a nice,
awesome.
really nice benefit that I think a lot of people are still not aware of. Do you want to tell us a little bit about the Persano primary care centers?
Yeah, so those are centers that are owned by Blue Cross. And really, actually what they did is initially it was for their employees.
Oh,
And so they
didn't know
kind
it
of
started off that way.
tested it out on their employees, yeah. And then now it's a part of the benefit for Blue Cross members. So they have access to a facility that is really there to round out their care. And that's also a way that Blue Cross is helping to manage their care. But it's a $0 cost for your primary care visits, for labs, for some behavioral health services,
Yeah, short-term counseling?
short-term counseling. And the doctors there, they are instructed and really have a passion for taking the time to understand the patient's needs.
Wow.
So
That's missing in a lot of practices.
it really is. It's almost like they're timed to get in
They
and
are.
out.
People feel like it's 5 minutes, or I've heard people say you can only go in with one condition at a time.
Yep.
So that's refreshing.
And that is with this Persano healthcare, they will take that time for you. They don't even have a way to take payment when you go in.
Wow.
So even if it's a situation where you bring up other ailments that you're having or things that are going on, they don't have the ability to take a copay from you
Wow.
or a cost share from you. So they're there to help take care of your needs as a primary health provider. You can get your labs there. And it's not just for adults, it's for kids too. So for families, it's
Yeah.
a great place to be able to, a one-stop shop. Like you can take your whole family there and not have to go to a million different places taking your kids
Right,
around.
or maybe something happens in the evening, they can be used for urgent care.
They can, yes, they absolutely
I
can.
think some of them have a pharmacy on network. I don't know how many of them have a pharmacy?
A few of them do, and they are just really a great, most of them say that they can get you in same day, so
Okay.
same day appointments.
Yeah.
With that, even further than the urgent care, they're able to, for non-urgent, get you in
Right.
same day.
Right. Yeah, that's so nice.
Yeah.
So they have 10 facilities, 8 in Maricopa County, 2 in the Tucson area.
Yes.
So do you think they're going to add more? Have you heard anything about that?
I think right now their goal is to build up the clientele and patient load at the ones that they have before they start adding more. But yes, certainly
sense.
I know that they are offering tours, and that's not only for brokers. Clients can go in there and get tours. They can interview the provider and make
Wow.
sure that it's a great match. And so they want people to have easy access to them in whatever
People
way
want
is
that
going to
too.
fill. Yeah. Make them feel good with their care.
Yeah.
That's their ultimate goal.
Right.
And those plans are a little bit more expensive this year, but maybe that's something that offsets the cost for somebody who needs that access to their primary care doctor
True.
for
They
their
don't have a
health
copay.
needs. Yeah.
And their labs are free?
Yep.
Basic labs?
So, and some of them do have some, like they can do some of the smaller imaging things that you might not need to go to another imaging center. It just
So
depends.
convenient also.
Yes. Yep.
Convenient, free. I mean, that's really a nice plan design.
Yes.
I like it when they are innovative.
Yes.
That's really
Yeah.
cool.
It's certainly a local, with Blue Cross of Arizona being a local carrier, it's a local benefit.
Okay. And I had a cousin that said she was one of the beta testers with her employer.
Oh, really?
So she said she had a really good experience with them.
Oh, that's good.
And that was a few years ago, so I imagine they've gotten better. But I think the word is still getting out. Like even I
Yes.
introduced it to some of my groups because it's showing up on the Blue Cross renewals.
Mm-hmm.
But not many really wanted to go that route. A lot of people are still focusing on the lower cost plans, but
Yes.
once you talk about the benefits, I think it could make more sense.
Some of those added value benefits that are in the plans that oftentimes people won't know until they're working with a broker that is able to help them understand the plans, and that they're not just choosing what visually meets the eye, but really understanding how their plan works and how it can work for them.
Yeah, a lot of people see the premium first.
Yes.
But then you're right, when we talk about how they use their plan, differences in copays, free care. So if they're flexible or have one nearby, kids.
Yes.
There's so many reasons to consider that.
And those are things that can change on an annual basis.
True.
So that is something that as their broker can, look at for them and help them to know, like, even if they remain on the same plan, these are other benefits that have been added for you, that carriers are really trying to be innovative with what they're adding for their members.
Yeah, and with my groups, a lot of times I'll say, let's offer a high and a low plan.
Yes.
Offer a bronze, but then also offer this silver plan with the Prosano centers, and it's worked out for a few of them really nicely.
Good. That's great. Yeah.
But I like to get the word out there because I
Yes.
really think it's a great new option for people.
I agree. I absolutely agree.
All right, so let's get into some chronic conditions. I know diabetes affects so many Americans, millions of Americans, and we have several companies that are offering great benefits,
Yes.
real tremendous cost savings. So let's get into that a little bit. Who has the best benefits? What do you think?
Well, it really is going to come down, and that's something that I say, that you need to kind of take into account for what your needs are. So what medications, because the formularies between the carriers can be different. So what are your diabetes medications? What would you pay, and how would they cover the insulin? Are you regularly seeing an endocrinologist that's managing your care? How often do you need lab work? Some of those things are now, with the plan benefits that the carriers are offering. United Healthcare, for example, they have built into their plans anyone that is diagnosed with type 1 or type 2 diabetes, they get free care for some of those diabetes services, so some of those management services. And it's all at free or no cost. Their covered insulin on their plans is also a $0 cost. So
Certain insulin.
Certain one, yeah. And that's
Okay.
where, when you're thinking about the plans, wanting to see what your overall costs are going to be, you want to compare with your broker, like Lisa, your insulin list your diabetes medication list to the
Supplies,
carrier's
yeah.
formulary. Yeah, and that's something that they've included for them. Oscar also has an outstanding plan. They built a diabetes-specific plan that they came to the market with this year. $0 primary care visits, $0 for those endocrinologist visits. Behavioral health they have included in there at $0 just to help with dealing with having diabetes, because that's a lot of time and effort and a lifestyle that a behavioral health specialist can help work through and understand your condition and how to live with that. So we have seen carriers start to build that in so that people can find that additional care and peace of mind. Lab work and eye and foot exams are all also under that plan at $0 cost.
Nice.
Cigna, even though they're exiting the market, if somebody is looking for a
Maybe they're
plan
on it
right
now, or-
yes, or maybe they're on it now.
Right.
They have some caps on the cost for insulin and diabetes medication as well.
That's awesome. So yeah, this is such an important consideration for people with these conditions because it's part of your overall financial health or your budget, your
And
care,
again,
getting
it goes-
the right care, and just making sure you have access to the supplies and things that you need too at a reasonable cost.
Because those can be so expensive. I think they're being a little bit more controlled, or we're seeing, more control on the costs for those. But even if they are some lower copays, they're need those services more frequently, or they need the medications at a larger quantity. So that's certainly something that, again, when you're looking at the plans, it's not just the monthly premium. It's what is it going to cost you when you go to actually receive the care, or when you're going to go fill those prescriptions.
Right. Yeah, and Oscar is one that offers several of those chronic condition plans.
They do.
Yeah.
Yes. Yeah.
So we're going to actually dive into that again next week.
Yes.
Because it is such an important topic. We're going to really talk about the benefits with these extra plans.
Yes. Awesome.
Okay, so beyond medical benefits, a lot of plans include rewards, programs, fitness memberships, wellness perks. Who do you think stands out with the extra benefits?
Yeah, so those extra benefits that when we're looking at them, when we refer to those can be a whole array of things. One that stands out, and that is a carrier that offers the richest rewards for their members, and they really have for years, is Ambetter. So members can earn up to $500 in rewards that they can use for things like utility bills, their monthly premiums. They can they have a free gym membership that they allow, and they actually piloted here in Arizona, where they can go to the YMCA.
Okay.
To
And YMCA offers a lot lot of programs, group classes, child
even
care.
online now
Yeah,
that they
a
allow
pool.
them.
There's one in the pool
Now.
stuff, so, yeah.
Well, it's so hot. Yeah. So yes, now the members do have to take action to earn those rewards. So things like doing a wellness visit, things like your preventative screenings for your medical needs,
Right.
And really coming up with those wellness goals. So what the goal is, why they give those rewards to members, is because it also helps them to see what kind of care they might need and help to educate them on where they can go, and ultimately for the carriers it saves them money.
Right, preventive.
Yes.
Absolutely.
So
Healthier lifestyle.
they're trying to incentivize their members for taking the action to take care of themselves, so
Right.
that they don't run into those emergency situations, or hopefully try and prevent those emergency
Right, or
situations.
let a minor condition turn into a major one.
Yes, yeah.
Good.
So Ambetter definitely stands out to that. United Healthcare, they have rewards up to $250 in Visa gift cards, so they're up there with Ambetter, but still not quite there. And then Cigna has some as well, but we won't do a
Won't
whole
be an
lot
option
of
for next
focus
year.
on them.
Yes,
But
since we're mid-year
for
now.
those that are on it now, they do have some wellness programs that can add value for them and give them some discounts for things like nutrition, eyes, if they needed a LASIK service, things like that. So,
Yeah. All right. Very good.
Yeah.
So that's great. Oscar's introduced several new innovative plans this year. Let's talk about some of those plans and what really makes them stand out.
They have. So they have tailored plans to help people. So they have, we talked just before about the diabetes plans. They have COPD, chronic kidney or chronic care condition plans, and then they even came to the market with a women's health plan.
Which is probably the first of its kind.
A lot of those on the individual market. We see some of those on the Medicare side or built in with some of the group plans, but really these are some of the first of the kind on the individual and family side. So what their goal is to, again, build in some of those value-added benefits for specific care with those plans.
Right.
So, again, with your diabetes or COPD, you're going to see some of those medications being at a lower cost, access to care being at a lower cost.
Yes, a lot of times free.
A lot of
free
times,
specialist visit.
Yeah, you're right.
I think that's one of the best
Lower
benefits
zero.
there.
Yes, yeah. And the kind of special thing about those plans is while they were built for people with those specific conditions, you don't have to have that condition to enroll in the plans.
So if you didn't have a certain condition, you can still get the no cost office visits for those on the chronic plan?
Yes.
Wow.
Yep.
That I wasn't aware of.
Yes, yeah. So we saw people enroll into the diabetes plan that didn't have diabetes because they wanted some of those extra benefits of being able to go see the specialist and have a lower deductible and some of the formulary or the prescription costs. We saw that. Now, right now, and hopefully that'll change, that diabetes plan is Omni or Salud Diabetes or something.
Yes.
They have it as a Spanish. Yes. So I will just point out that if you receive your benefits in Spanish, you simply just have to call member services and ask them to send out the new packet in English.
Okay. Yeah, and Oscar's the one that has a really nice app.
Yes.
So you can talk to providers, you can, look up your doctors.
Their technology is stellar.
Their app is wonderful.
Yes. I also think that they have amazing customer service, that you have really your own guide, and it's done by state. To where when you call in, the hope is that you will continue to connect with the same person. So you can develop it, unless you're calling a lot, but yes, comfort or just at least peace of mind in knowing that their focus really is their members and running to give an easy experience there.
Yeah, so you can reach out to them even with benefit questions or billing questions, anything.
Provider questions, things like that.
Awesome.
Yeah.
So Oscar really has gotten the attention of a lot of my clients this year. Besides, they were priced pretty well.
They did come to the market competitive.
The prices going up so much this year. Oscar kept them a little bit lower than some of the other companies. So
and they do have a good network here of providers. Yes.
I find a lot of, because that's what I start with, is the doctor search. So we have good luck with Oscar.
Yes.
And that's another reason that a lot of people gravitated towards them.
Yes. Yeah.
So another question that I get a lot is dental and vision included? So it's not with all plans. It's not all really a typical benefit, but there's a couple companies that have added it. So about $1,000 benefit. Which companies do you think stand out for that?
So Ambetter and United Healthcare have plans that, Ambetter, you can add that to any of their plans. And then United Healthcare has some plans that it has adult dental and vision built into it. It is one of the misconceptions, I think, that people think when they're getting the plan that they all come with adult dental and
or
vision.
Or it lists a couple child benefits and they don't realize it's just you have to be less than age 19.
Yes. Or if it is a plan that doesn't even include pediatric dental, when they get that adult dental and vision added on there, it does not cover the kids, unfortunately. That truly is for somebody 19 or older. Yes, so United Healthcare and Ambetter are your two carriers there that you can look at and add that additional benefit. And those dental benefits are a good cost if
Yeah,
you're
they're reasonable.
somebody.
$25, I think, was the one I quoted today.
Yes,
Yeah.
and you can't really touch a whole lot of plans outside of that
True.
for that dollar amount. But what I will say with those is that it's good for people who just really need that like basic preventative care, because that $1,000
It can go quick.
annual maximum
Yep.
can go very fast in the
Yeah,
dental
just with
world.
your cleanings.
Mhm.
Yeah, or maybe some x-rays or a little
Yes.
filling or something.
Basic, yeah.
True.
Yeah, and then the dentist network can be a little bit smaller than some of your other
Yeah, Delta's
off
so big out here.
exchange. Yes, yes. So that's the other thing is just making sure that either your dentist is in network with that or being open to the providers that are in that network, knowing that you're going to pay a lower cost for that.
Right, right. And then the United plans you can identify because they have the plus sign
Yes.
in their plan, which people may not realize
That's
initially.
a good point out.
Yeah. We've talked a lot about marketplace plans. How about the plans that are off marketplace? I have a couple employer groups that just offer an ICRA. Do you want to talk about the off marketplace plans and maybe expand on the ICRA too so people
Sure.
know what it is, or QSARA?
Yeah, so ICRA is a very hot topic right now.
It's growing each year. It's getting more and more,
It is.
people are getting comfortable.
And it's just an alternate option for employers now, especially when we're seeing these premiums skyrocket
Yes.
at renewals. It's an alternate option that an employer can still provide a group plan to their employees, and it's a reimbursement. So it gives a set allowance that's determined by the employer to their employees to where they can then go out and purchase their own health plan for them and or their families, depending on how the employer sets it up.
So instead of one or two plans, you have like 80 plans to choose from. Or,
Yes,
yeah, at
it
least
gives
50
you
plans.
the freedom as the employee to choose your healthcare plan.
Mm-hmm.
And we really have seen not only employers find excitement in that because it takes some of the load off of them of having to choose a plan that they think is going to best fit their employees, but it really has given that control back into the employees' hands.
Yeah.
That they can find the plan that's going to best fit their needs for them and their
Right,
family.
which company, which network, and then which plan within the company.
Yeah.
And
So
control for the employers as well, because they can say, I'm going to reimburse $500, or and it keeps their costs manageable each year too, right? It's
we've
control for
seen
them as well.
groups save millions off of their plans.
Wow.
Especially, some of your larger groups
Yeah.
with the renewals, it really has brought in that savings option.
Nice.
So Amber is a carrier that we have seen really dive into
focused
this,
on it, yeah.
and their off-exchange plans are built for those ICRA plans. Now,
Mm-hmm.
you don't necessarily have to be on an ICRA to enroll in the off-exchange plans, but
Right, maybe you don't qualify for a subsidy, you want to keep
Mm-hmm.
it simple. Some people are, I don't want to be on HealthCare.gov.
yes, I want nothing to do with the government. Don't take me there. But
Right.
yes, so that's where we've seen ICRA come into play is for those off exchange, and why they wouldn't enroll on exchange is because with an ICRA, one is not eligible for the subsidies that you typically
It's kind of
do
like
go
an
on
employer
exchange
subsidy
for.
versus a government subsidy.
Exactly.
And that's I think that's an important distinction too, because a lot of people may not be aware you can't double dip.
Right. You have to choose one or the other. And you do still have that choice. So depending on what your income is in working with your broker, you can determine whether or not with that reimbursement that you're getting from your employer, if it's deemed as affordable or unaffordable. And I'll do that.
Right.
Affordable or unaffordable. I'm doing
Roughly
quotes here.
10% of gross. Well, it's a calculation, but yeah, we won't get into that right now.
Yeah, but yes, so it is an option you still have to go on the marketplace, but I would just say the calculations are a little bit convoluted there, so just work with your broker on that to determine what's the best fit for you.
Right, perfect.
Yeah.
So as we wrap up, if you had to summarize the strengths for each company, what would you feel would be each of their highest strengths?
Yeah, so I would say Ambetter is a great carrier if you're traveling and maybe you're coming off of an employer PPO plan.
A transition plan.
That Unfortunately, there's no PPO plans in Arizona. So it really is a great transition of still offering a little bit of that flexibility with those that need to travel, not requiring that referral.
Right.
So that's a great option for them. Antidote is a carrier that we haven't really mentioned a ton. They're a little bit newer to the market, but they do have a virtual telehealth that is there as the first step for non-emergency care. That is a good virtual healthcare option if you're really technology savvy and wanting to start there. It's a $0 cost, and they try and help manage care that way. And then Blue Cross, like we talked about with those Prosano facilities, that's really an added benefit. Now make sure that if you're selecting a plan, it has to have Prosano in the name to be able to access.
Start at silver level.
Yes, yeah. So even, Blue Cross is a carrier. They're local, boots on the ground here. A lot of people really like that.
Or they've had experience with them with their employer.
Yeah, they have, or they have a good experience with their employer. Also, providers have good relationships with them. So some added benefits to being local. Cigna's strong, like we said, for those that needing access right now to Dignity. So that's kind of your option for Dignity. And then Phoenix Children's, that's going to be Imperial.
Yeah, Imperial only.
As soon as you need that Phoenix Children's access, you're only going to be able to go through them with Imperial.
Yes.
And then Oscar, like we've said, they really have been one of the most competitive carriers this year. And living up to that, their plans and benefits and network of providers, and they're a great option, just an overall rounded out plan benefit premium.
Yeah, I love all the new plans that they're coming out with too. I wonder if anybody will follow next year.
It'll be interesting to see. We'll know soon.
Do we have any sneak peeks yet?
Not yet. Okay. No, just we'll probably know more closer to September, I would say, with some of those plans.
I'm curious. That was a wild open enrollment last season.
Oh my! And I think it is still going to be pretty wild, just with the shorter period of time right now, unless that changes.
Yeah. So it's November 1st through December 15th for anybody who may not be familiar.
Yes,
and that's when anybody can enroll. No special events.
Yeah, and I will point out that it is a requirement right now this year that you have to manually renew your policy between that time frame. So
not just for the $0 people.
Correct.
Okay.
Yeah. You could potentially lose your subsidy if you don't manually renew the policy. So just make sure that you connect with Lisa so that you can do that.
Or your broker, wherever you are.
Or your broker, wherever you are. Yes.
Yeah. Or you can manually renew yourself.
You can.
But it's really easy for the brokers to do it, and that should be part of their service.
Absolutely.
Yeah.
Yes.
And just connecting, because it's a good idea just to talk every year. Did anything change? Do you have a surgery coming up? If the surgery's coming up, we're going to look at the premium and the max out of pocket.
Yes.
What's the lowest cost?
And where you need to go.
Whatever your preferred company is. Yeah. Based on doctors and network and all the things.
Absolutely. Yep.
Okay. Do we talk about United?
United is just a well-rounded option. And then with their enhanced diabetes benefits that they have built into all of their plans, that really kind of gives that great option to search within the plans, premiums, what fits your needs, and then find that that plan that's going to be a good fit. They have a $0 medical deductible plan. That is a good option for a lot of people.
That too.
Yeah. Both Oscar and United Healthcare have those $0 medical deductible plans.
Okay.
Yeah. And United Healthcare is a well-known name.
Yes, everybody, they want Cigna, Aetna, Blue Cross, United. I'm like, well, we have some other carriers that we want to consider too.
And that's something when you're considering the plans, while they might be a well-known name, or you might be coming off of them from a group plan, that doesn't necessarily mean that the networks and the providers are the same within those plans.
And they're not the same.
Yeah, and they're not the same. Yeah. And actually, in many cases, they're separate entities altogether, where they fall under the same carrier name and umbrella, but they operate as separate groups of plans and people who work for the
different
plan.
Experience,
totally.
Definitely a different network.
Yes.
And then United people may not be aware of the referral requirements.
Yes.
Some people are somewhat comfortable with that, but some people don't. And I don't recommend that somebody that has 8 doctors, we want to kind of skip that option if we can.
Yes. And it can depend on how good of a relationship you have with a primary care doctor, too.
True.
So,
okay, well, this has been tremendously helpful.
Good.
I'm so glad that we got together. And any final advice for anybody?
I would just advise working with a broker, that they're there at no cost to you. Their job is to be an expert in the market and to keep up with the changes in the market and the plans coming to the market. So they're your guide, and to be there to help you find the best plan to fit your needs, and taking into account all of those areas that we talked about. So really, the goal is for you to find a plan that best fits your needs for the upcoming year. Right. And that's a broker's job. Yes. So they're there for you, not to work against you.
Yeah, and there's so much behind the scenes. Like everything we've talked about today, I don't know if it would even be out there if somebody could find that on their own. These chronic plans, the extra diabetes benefits. It changes every single year. So it's just, if you don't have one, talk to all of your advisors. If you're a financial, a tax advisor, your auto and home person, those are the people that are going to probably have a team to help.
Yeah, you want somebody in your corner.
Yeah, and make this easier for you. It doesn't have to be crazy stressful, which a lot of people, when they first call, they are so stressed out and worried, and they've tried to go on HealthCare.gov. I'm like, nope, we're going to make this easy.
Yep, and there's no dumb questions.
Right.
People think don't be
People
afraid
think that they are dumb
to
questions.
ask.
So everybody asks that.
Yeah.
It's common.
It's okay. Even if the broker's heard it 1,000,000 times, you haven't. You as the consumer haven't heard that. Right. So I
tell people I want you to feel informed, and you're gonna make an important decision here. This is very important. Maybe not today, but it might be 6 months from now.
Yes.
And I have that happen every year. Something comes up with my clients, so you want them in the right plan.
Yep.
You don't want to move each year either, right? You want to put them in the right plan, and then they get their network established, and then they're awesome.
Yes.
They're great.
Yeah. Leave knowing that you have peace of mind. You understand your plan, and that you're able to reach out to your broker for guidance. Maybe the broker can't do something to help you. Call the carrier themselves on some things, but they can at least guide you on what to say or where to go or how to get the help that you need. So just leave with the peace of mind of knowing your care is taken care of in all facets.
Yeah, I think it's really helpful, too, when calling the marketplace. A lot of times I call with the client.
Yes.
Because you might get somebody that maybe doesn't have the answer to your question, or I've had them where they might try to lead them to do a new application or make a plan change.
Yes.
Like, no, they're good.
Yes.
So.
Yes. And if you call direct and you're working with a broker, oftentimes they take that over as a direct sale, and then your broker isn't on the things that they are able to take care of in the background for you. They're not able to do that. So yes, I absolutely recommend calling with your broker when you can to the marketplace if needed.
And it's harder to get your broker added back now too.
Yes.
It's going to be even more challenging, I think, next year. Okay.
And you might not even need to call marketplace. The broker might be able to do it for you without having to make that call.
Well, that's what I tell my clients too. I'm like, you probably don't need a marketplace account, because they're like, do I need to set this up? I said, set up your member portal with your insurance company, and we're probably good.
Yes.
Even if we need to update income or something, that's super easy.
Yes.
It's a 5-minute phone call. So.
Perfect.
Okay, awesome. Well, we are bringing Kim back for part 2 in next week, and we're going to dig into those ACA plans for specific conditions like diabetes, COPD, and even the one-of-the-kind new menopause plan for women. So thanks for joining me today.
Yeah, thank you so much for
sharing your
having
impressive
me.
knowledge. So if anybody any brokers want to connect with you, where should they reach you?
So you can either email me at kim.anderson@blackgould.com, and Gould is GOULD, or my phone number is 602-776-1336.
Okay, awesome. From a host perspective, this was incredibly helpful, and just to hear another advisor's insights and to kind of fill in even more of that knowledge. So thank you again for being here.
Thank you for having me, Lisa.
So I'm Lisa Martin, your health insurance Sherpa. Thank you for listening today. These podcasts are for you. Wherever you are on your health insurance journey, think of them as a library you can return to whenever you need guidance. If you've enjoyed this episode, please subscribe on Apple, Spotify, or wherever you're listening from now. And don't miss another episode. You can also reach me at lisa@ecafinancial.com or 602-852-5215.